The topic for my research proposal is called Exploring the Overlap Between Occupational Therapy and Art Education, with the goal of supporting students' fine motor skills development. My name is Laura Beyerle-White. I am a K-6 art teacher, currently in my 8th year of teaching, and this is the 4th year at my current school district. I became interested in this topic because of a new course I was assigned to teach this year, which is essentially a small group of life skills students. Um, and I was thinking about the function of this class and how it could help them both succeed more in the art room when they're also coming with their same grade level peers, and also how the skills that we could build in the art room can help them have independence in the rest of their education as well. So those are some of the factors that led to me developing interest in this topic. My research question is, how can I utilize occupational therapy inspired techniques and other approaches to support fine motor skills development for my special education students in a supplementary art class? I think this topic is highly relevant because from what I've researched so far, even though there has been a lot published related to the topics of disability and art education, there's a gap regarding that academic published works and with a focus on fine motor skills development. Also, experientially in my teaching, I've noticed, and other art teachers I've talked to have noticed, that incoming kindergartners are possibly also struggling more with fine motor skills compared to kindergartners X many number of years ago. I think as well there's a lot of overlap potential in the fields of occupational therapy and art education. And some of those overlap goals are currently unexplored. The more collaboration we could have between those fields, I think it would offer more potential benefits to all students. For example, maybe some students are on that liminal edge of whether they would qualify for occupational therapy services or not. But if there was a greater awareness in art teachers or even general education teachers about how to offer supports to all students when they're learning fine motor skills, maybe that would help bridge some of that gap. A few articles that I have reviewed that I found highly informational for my topic were these articles. One is from a publisher who's writing about the least restrictive environment and how that was actually playing out in reality in a high school classroom. Something I've noticed in my own art room is that sometimes it seems like policy that's decided somewhere else impacts and trickles down in a way that is confusing and maybe I wasn't prepared for as a first year teacher. So it's interesting to think about the gap between theory and practice. And this first article by Michelle Kraft explores that. Another article I found really useful was an article by Milrath and Siegel, and they were studying the artworks of a autistic child. I think that their method of research was something that was really interesting to me as I think about how this research question is going to evolve for me in my classroom. I liked that they had a case study perspective with multiple methods of data collection, including interviews with the family and the child, as well as looking at the child's artwork over time. And the last article that I found especially meaningful was by Wexler, and she has a case study following a practice where different students could come and work in this art studio environment that maybe they did not otherwise have access to. And the article also has an emphasis on disability and art education and how creating opportunities was very meaningful to these students in this experience. My philosophical framework I would describe as primarily ontological. So I'm interested in how learning relates to people's individual experiences. Uh, an anecdote I shared in that informs this perspective of mine was that as an adult, sometimes it's hard to remember how we were first learning fine motor skills. And I had this experience where I noticed a student was really struggling, so I tried to do the same assignment as them, but I used my non-dominant hand to sort of give me a handicap, so to speak, and make it so like it didn't seem like there was as much gap between the student and me. And in this experience, I realized it was easier for me to do line art and more difficult for the hand muscles that involve just coloring with my non-dominant hand. And that was something I noticed in some of my younger learners. They can do really detailed drawings, but then when they start to color, it like looked messier to me. And I didn't understand why that was because they could do what I thought were very neat drawings. Um, but it's a more matter of muscle control. It's not a matter of, oh, I'm just rushing to finish, in some cases at least. So keeping in mind that everyone has an individual perspective and that informs them is something I uh, really carry with me. I also appreciate the social constructivist paradigm, which I think there's a lot of relationship between those two framework and paradigm as well. But with the social constructivist paradigm, I would be thinking that it's important to take in context and consider history, and that's those things create a network of how we make meaning in our lives. For my chosen research methodology with this proposed case study, or with this proposed study, I think case study is the most relevant path forward for me here. I'll talk more later when I talk about my mini pilot study, but I started out with an interview, and I additionally think that this methodology would work well to describe the story of how I want to investigate this research question with regards to this small group of students. I think that case study methodology could be supported in my study as well with narrative research, arts-based research, or action research. Those could also play a supporting role. For my data collection for my mini pilot study, I set up an interview with our school's occupational therapist. Data-wise, I chose to record this video so I could just transcribe it. It was a Zoom meeting we ended up having due to scheduling. So that also gave me the opportunity to later take screenshots of relevant moments where she was gesturing about a technique that she would use. And for future data, I would like to collect other interviews or schedule other interviews. I would also like to have observations of my students and even possibly permanent products like their artworks inform my data collection. With this topic, it's really important to think about the ethical considerations. Obviously, informed consent is always important so that people can choose to participate or not in a research study. Another consideration for my topic, since I'm working with some of my special education students, thinking about their IEPs and remembering that an IEP is a legal document. And there's also like concerns about security, who has access to this, who doesn't, and all of those ramifications is important. I don't think the study proposes any ethical risks, but it's useful to keep in mind as well the power dynamics in research, that the researcher may be historically or in context could hold more power than the research subject. And that to me kind of parallels in teaching. The teacher has more power than the students, so it's important to just be mindful of that and respectful of contexts. And as well, since I'm working with my special education students, I think the topic of disability justice is very important. Um, and that can have lots of different implications. One thing that's top of mind when writing, for example, about disability and special education students is that word choice matters, how you describe people matters, and different community members might have different opinions on that. So respecting whoever you're interviewing or things like that is very important. So for my mini pilot study, I interviewed our school occupational therapist. I had a list of questions prepared, and it was really interesting to talk to her about some of these because I came in, despite my interest in this field, really not knowing very much about the background of occupational therapy. One of the things she said is that the main goal of occupational therapy is to help your client or your student gain as much independence as possible. That's like the overarching goal. She talked about how she would set goals with students. Maybe, for example, they have a goal related to handwriting legibility and different ways to measure that with both qualitative and quantitative data. Um, she talked about some strategies that she uses to modify tasks. For example, One student was having a lot of trouble focusing on a task. And so she mindfully handed that student a fidget toy that could actually target some of the same fine motor skills that she was trying to use develop that session with that student. It was one of those puppet ones, and that's still working some of the same finger muscles that the main task would have been trying to focus. And then with that conversation, she also emphasized that flexibility and feedback are so important. She has to be flexible and modify things depending on the needs of the student that day. She also is relatively new to working with school-age students. Previously, she worked in a clinical hospital setting. So seeking feedback from others in the field was really important for her as well. And a lot of these things in the conversation really struck me as being similar to education. We make modifications for our students all the time. We have to be flexible and adjust, etc. Um, so going forward, it would be wonderful even to have maybe another interview with her and be able to dig into some of these topics more deeply, or to look and see if there are other occupational school based occupational therapists I could interview and compare their experience to hers. Overall, I think there is a lot more left to explore with this research. And like I was saying, it has implications as well for general education students and not just this one, um, not just a small group like special education students, even though that's the focus for my research study. Yeah, thank you very much for listening to my presentation, and I would be happy to answer any questions you have in the responses.